Fruit destined for export remains shelved in cold storage as the Transnet strike continues. Deciduous fruit industry leaders say port authorities have assured them their goods will be prioritised, but they have to wait for cargo to start moving. Berries ZA is pleading with Transnet and unions to resolve the impasse. It warns the livelihoods of thousands of workers are at stake.
Right now, we are putting full demand on our cold storage facilities. That's the best we can do at this stage. There isn't any immediate operational solution to get containers out for obvious reasons. Transnet have given us an indication that they will request the prioritization of highly perishable goods and produce as soon as there is any movement. We are communicating with them around our container requirements over the next this week and moving into the next 4 weeks. We're looking at least, on average, 85 containers that we need to be getting out per week. So we are already almost towards the end of the first week, and that means we're 85 containers on the back foot. So for us to recover from that, we'll need to have a very efficient clearing program for those containers, and we're going to rely heavily on that operational plan from Transnet to facilitate that.
The Mamelodi Regional Hospital has been upgraded. 13 renovated and extended units will be opened today. It's part of a project to enhance public health care. Health Minister Joe Phaahla and Gauteng Premier Panyaza Lesufi will officially open the units. Our reporter Heidi Giokos is there and joins us live. Good morning, Heidi. I'm sure the community of Mamelodi is elated along with the hospital staff. Just talk to us about today's event.
Yes, indeed, Mfundo. We are at the Mamelodi Regional Hospital where we are expecting the Health Minister, Dr. Joe Phaahla, together with the newly elected Premier of Gauteng, Panyaza Lesufi, together with the MEC of Health in the province to officially open the 13 newly renovated units here at the hospital. We are still awaiting the arrival of the Health Minister. We've been told that he had to attend an emergency meeting, but the MEC of Health, together with the Premier of the province, is here at Mamelodi Hospital, and they are just in a closed meeting, I presume, just probably getting briefed about these units that have been revamped. My colleague Linga is showing you possibly the area where the Premier is at the moment. But I think this is quite a significant move and an important one, given the state of healthcare in this province and how there has been much criticism about the state of many hospitals in the province. We will, of course, get further detail as to how these 13 newly renovated units are going to help in terms of healthcare. I think what's also important to get clarity on, Mfundo, is whether or not these new renovated units are going to be exempt from load shedding as well as these water restrictions. Previously, we've been highlighting the fact that two main hospitals in the city of Johannesburg, Helen Joseph and Rahima Musa, have truly been struggling when it comes to load shedding as well as the water restrictions. So how is this going to be factored into making sure that these hospitals can operate despite the fact that we have these challenges of load shedding and water restrictions? It's a massive problem. Doctors are getting sick, cleaners are getting extremely frustrated as there is no water, and as much as you hear from Gauteng Health or the Gauteng government that they are trying their very best to sort this out, it's still a major problem that keeps popping up. So we'll be asking all these questions, and we will be, of course, moving around to these newly renovated units to see what they bring about and how they're going to improve the lives of possibly the most vulnerable in our society.
All right, Heidi, we'll leave it there for now and catch up with you a bit later on once you do have those answers around.